My name is Shawen Ilaria. I'm a psychiatrist here at Rutgers Robert Wood Johnson Medical School. First of all, we want to acknowledge you for all of the hard work everyone is doing here in the healthcare system during this very important time. Let's acknowledge that this is a scary time. I think it would be helpful to talk about anxiety. Certainly there are positives to anxiety. We need a little bit in order to motivate ourselves and to get anything done. And it's normal to feel a little bit more anxiety during a stressful time. You might be feeling concerned and worried about what's going to happen next. You may be imagining the worst case scenario. You could be feeling more easily frustrated in your day-to-day life. You might be worrying more about loved ones than you're even worrying about yourself. You may feel more restless when you're trying to relax or take a break. And you also might feel guilty when you do take a break or when you're not at work, that maybe you're not doing enough. The signs that anxiety may be getting too high for you, in general, we like to say it's when you really can't do your day-to-day tasks. Some specific signs that anxiety may be getting too high. One would be that you have a complete preoccupation with consuming media and news that is around you. Excessively fearful or worried, especially compared to other people that you know. Isolating from your loved ones, your family and friends, feeling disconnected and numb. Poor self-care, such as poor hygiene, lack of appetite or losing weight. Feeling wound up, easily startled or on guard all of the time. Insomnia, the inability to sleep. And perhaps turning to bad habits such as alcohol in order to cope. These are all signs that it may be time to seek more formal support. We've put together a list of actionable tips to help you during this time. It sounds simple, but meet your basic needs. Eat, stay hydrated, sleep regularly, because depriving yourself of these would put you more at risk. Focus on eating healthy, but also don't put too much pressure on yourself and have a treat every once in a while. Keep routines normal when possible, and I suggest actually creating more routines during this time. If you used to have a weekly team meeting that's been canceled, try holding it virtually. If you used to call a loved one occasionally to say hi, set up a weekly time to chat. For some people, structure actually reduces anxiety. Speaking of creating more routines, you need to take breaks, and you may even have to schedule those breaks. Take a walk or just get some fresh air, FaceTime a friend, listen to music, read a book. Actively seek out ways to relax. A key tip is to limit media exposure. You need to do what works for you. Perhaps you need to create some rules about how many times per day you're going to check or what sources you're going to read. Maybe your day off means that you don't check media at all. It might be a totally unplugged day for you. The bottom line, use media just enough to be informed, then turn it off. Communicate with your support system, especially the people that you live with. You need to communicate what your needs are during this time. Perhaps you need to come home from work and debrief about your whole day, or maybe you want to come home and not talk about work at all. Communicate what you need and also listen to what your loved ones need in return. Be aware that your needs may change over time, from day to day or from week to week. Monitor your colleagues' workloads. Recognize them for their hard work, encourage them to take breaks, and share things that maybe were helpful for you. We're stronger as a team, and if we continue to work together and support each other. We want you to know there are resources available. Communicate your needs, and don't hesitate to ask for help.